everyone, welcome to Clinilaunch Knowledge Pod. In our last video, we discussed about common mistakes in medical coding. And as promised, today's video is about how to overcome them. Even experienced medical coders can make mistakes, but unfortunately leading to financial losses and compliance issues. So here we are discussing about solutions that can be used. Errors like incorrect code selection, like coding fracture as a sprain due to similar symptoms. The solution would be referring to appropriate coding systems like ICD-10-CM or CPT and using comprehensive coding guidelines. There is missing or incomplete documentation like failing to document the severity of the wound or exact location of the pain. To ensure the document is complete and accurate, including all the relevant and essential details needed for coding. Coding errors due to lack of knowledge and training can lead to using outdated codes and misinterpreting coding guidelines. By providing ongoing training and upskilling the coding staff to keep them updated with the latest coding rules and guidelines can easily solve this problem. Failure to use modifiers to indicate bilateral procedure or different site of service can be easily overcome by understanding and applying appropriate modifiers to reflect accurately the service provided. To solve coding errors for unsupported services which are not documented or performed, ensure that all the coded services are backed by medical record and align with patient's diagnosis and treatment plan. Unbundled errors. Coding separately for procedures that are bundled together. Refer to appropriate coding guidelines to identify the bundled services and avoid double billing. Coding for unspecified diagnosis, like using generalized code over a specific one, can be resolved by using the most specific code currently available to reflect the patient condition accurately. Incorrect sequencing of codes. It can be overcome by following guidelines for sequencing of codes which ensures accurate billing. For solving coding errors for out-of-network services provided by other providers without authorization, verify that all the services are covered under patient's insurance plan and these services are authorized. And coding errors for investigational and experimental procedures which are not covered under insurance, we have to consult with the payers and regulatory agencies to determine the appropriate coding for this. To prevent these common mistakes, any healthcare organization should invest in training and educating coding staff, implement quality assurance measures like regular audits and reviews, and using softwares and tools for automating tasks, and very importantly, stay informed about industry updates with changing coding guidelines and regulations. So here we have discussed some of the most common mistakes in medical coding and how to overcome them. By implementing effective strategies, healthcare organizations can prevent financial loss and comply with regulatory agencies. I hope this video was useful and do check out our latest videos by subscribing to our channel.